I'm Dr. Laura Gallistel. I'm a pediatrician.
It's very fun being a pediatrician. You get to see kids when they're born and see them as they develop and grow, following them through the developmental milestones just like the parents can. It's fun seeing them come into clinics, asking what they can do now, when they can start talking to you, interacting with you more. With pediatrics, I think you need to look at the whole family. It's not just the child that's in the room, because it's the parents taking care of them, it's the siblings and everyone else that's involved in the family. It matters what's going on with them, and that affects the child's health care as well. You know, there's many different ways you can communicate with families and with patients. A lot of it you have to take into account their personality styles, how they learn the best as well. And it's something that over time you get to know, and I always ask families what questions they have and make sure that they don't have any other questions before they leave the clinic. I like to have the whole family involved in the visit. I like kids to think it's fun to come to the doctor. I don't want them to be scared. I like having families understand what's going on, understanding the child's diagnosis as well as the treatment plan, and having all their questions answered at the end of the visit. A lot of the visit is being an educator. When children come in either for well visits or sick visits, I like to talk about the diagnosis, the treatment plan, giving parents helpful ideas if they have questions. So a good portion of it is being an educator, and I always like to have the families be able to understand what's going on with their child and the children to understand what's going on with themselves as well. Prevention is a very important part of pediatrics as well as healthcare. At all well visits, I like to talk to families about prevention, things that they can do to keep their kids safe, preventing injuries. We talk about illnesses. And then at the sick visits, if the child would come in with a sick visit, I like to talk about the illness itself, and if it is contagious, we talk about that to hopefully prevent other family members from getting sick and other contacts. Some patients can be worried about what's going to happen to them at the doctor's visit. We're worried if we have to do any procedure or anything like that on them. I like to help make them feel more comfortable, explain to them what's going on, explain to them that I'm going to listen to their heart now or listen to their lungs, and kind of tell them ahead of time what I'm going to do. That way I'm not just jumping into it to make them feel a little more comfortable. I'm very attentive to detail. I like to make sure that everything is in order and making sure the patients are having the best care as possible. It's wonderful working with kids. They go through so many different developmental stages with growing and changing. It's wonderful seeing how they go through those stages, and when they can come in and start telling you stories and what they did for their birthday and all that kind of stuff, it's very fun.